This is a video regarding the neurologic system, so it's just a checklist of different neurological assessments that you can do on a patient. Hi, I'm Sydney. I'm your student nurse today.
Hi.
I'm just going to do a quick assessment on you, if that's okay.
Alright, sounds good.
So, first when I walk in, he's responding appropriately. If he was a little delayed or anything, you could ask those orientation questions. And then if they're not oriented, you can also ask them to follow simple commands such as grab my hands, squeeze my hands, things like that. So first, I'm just gonna have you close your eyes, and I'm gonna touch your face and your arms, and you're just gonna tell me if you feel it equally on both sides.
Okay.
Okay, ready? Feel me touching here.
Yep.
Down your arms here.
Yes.
To your legs.
Yep.
So that's just feeling for sensation. If you had any lack of sensation on one side, you would go further in depth on that. You'd also want to assess the cranial nerves during this time, so check out the cranial nerve assessment video for that. I'm going to have you stick out your arms and just hold them out.
Okay.
So for this, you want to make sure that one of their arms isn't drifting to the side. They're both staying up and they have the ability to keep their arms up. And you push down on my hands, push up on my hands, perfect. And then squeeze my fingers. Make sure to not give the patient your entire hand because some of them will really squeeze down. Give them 2 fingers so they can hold it as hard as you want and it won't hurt you. Can you push your feet against me, pull them, or same thing with your ankles and feet, push down, perfect. I'm gonna test to make sure that he has sensation ever, so it's kind of like a game. You have them close their eyes, touch or feel one of their extremities, and have them guess which one it is. So ready?
Right arm. My left leg. My right leg. My left arm.
Perfect. And then also you're gonna have them test their coordination and balance, so you can watch them when they walk in, watch their gait, watch how they're walking, see if they use any other mobility devices. So just because Liam's sitting, I'm gonna have him do a series of rapid movements. So you can either have them pat their legs fast, or you can also have them touch their thumbs to each finger and see how fast they can do it. So I'm gonna have you do your thighs and just perfect. And then with your fingers, touch each finger quickly as you can. Perfect. So that's assessing for their coordination. Another assessment you can do is called the Romberg Test. So this tests the patient's gait and balance as well. So you're gonna have the patient stand up with their eyes open, just still for 30 seconds. After 30 seconds has gone by, you're then gonna have them close their eyes. So while they're closing their eyes, you don't want them to be swaying around and losing their balance. So Liam, can you stand? Perfect. So he's just standing here, eyes open, he's not swaying. He just doesn't have a lack of balance, and then you're gonna have them close their eyes and stand there for 30 seconds. Perfect. And if they were swaying, make sure to stand close by because you obviously don't want them to fall.